Introduce myself. My name is Professor Elizabeth Johnson. I am the Dean of the European University Cyprus School of Medicine. And today's webinar is part of a series, So You Want to Be a Doctor. Actually, over the last few weeks, the last 3 weeks, we had a series on So You Want to Be a Doctor. The first 2 webinars were about how to get into medical school with 2 very critical steps. One was how to ace the interview, and the other was how to stand out on your personal statement. Last week, you heard a very interesting webinar about what it's like when you're in medical school by Dr. Dourakis about mastering medical skills. Today, we're going to talk about what it's like to be a medical student at European University Cyprus. In doing so, what I'd like to do is tell you a journey, the journey of becoming a medical doctor at your European University Cyprus, what your life will be like over 6 years. Actually, if you let me, I want to tell you a story. I want to tell you a story about one of our students named Lucas. Lucas, like all of our new students, when you join us at European University Cyprus, you're introduced to us by a medical student orientation program. It's actually quite extensive, 3-4 days of learning about our program, learning about how to study, how to take care of yourself, how to get onto Moodle, how to do all of the activities that you'll need to do over the following 6 years. An important part of the orientation program, though, is the white coat ceremony, or the convocation ceremony. If you look at the picture on the top, you can see on the white coat ceremony, students are called one by one to the stage, and they're given their first white coat. That's the mantle of your profession. That's the mantle of being a doctor. And if you look closely, you can see that you're given your coat by one of your professors. The professor is giving it to you and putting it on you. What does this mean? It means that you're now entering a new family. You're becoming part of our family, the family of European University Cyprus Medical School. But also each professor is telling you that they're going to guide you and train you over the next 6 years. A very important part of this convocation ceremony is the oath. This is not the Hippocratic Oath. You'll do that later. This is an oath pledging yourself to the standards of being a good student and learning medicine with the ethics and means that is required. Now, 6 years later, the end of your journey will be this, the graduation ceremony or the commencement ceremony. And when I tell you about it a little bit more later, you'll see that there's a lot of symbolism here too. What happened to Lucas? I'll tell you at the end of the webinar. Now, we have students from all over the place, almost 40 different countries, a very interesting and very dynamic student body at European University Cyprus. They all come together to learn medicine. Now, in order to understand our medical curriculum, you actually need to understand what is a modern medical curriculum like the one we have at European University Cyprus like? What does it need to do? Here we need to look at how things were in the old world and the new world in terms of practice, the source of knowledge, and education. In the old world, everybody did something individually. They knew everything, whatever they learned, they were the expert. They didn't need to learn anything else. Things are different now. Today, we know that medicine is practiced as a team. Remember this because you'll see the team coming up a lot in our curriculum. The source of knowledge is the evidence, and education is continuous. You always need to learn. Today, the 3 most important words in studying medicine, actually in being a good medical doctor as well, is I don't know. Why do I say that? Why do I say these are the 3 most important words in being a good medical student and being a good medical doctor? It's because medicine changes rapidly. Actually, medicine will change more in the next 20 years than it has in the past 2,000 years. Medical knowledge is doubling at a rate at almost every 3 to 4 months. What happens is that what I teach you today, tomorrow, may not quite be true. Things have changed. Actually, as Dean Burbel from Harvard said, half of what you're being taught as a student will change in 10 years. And the problem is that we don't know what's going to change. There's an additional problem to that in terms of trying to make a good medical curriculum, a good medical program, so that you can become a good doctor. It's the problem of plenty. What do I mean here? There's a lot of knowledge. There is a lot of new knowledge. Last year alone, there were 6 million new scientific articles in biomedicine. This affects the way we teach you. This affects what you need to know. At European University Cyprus, we decided to devise a curriculum that emphasizes the integration of knowledge in relation to medical practice. This is called a competency-based, integrated spiral curriculum. A lot of words. What does that mean? Competency-based. You learn skills, you become competent. What you study, your knowledge is integrated to your practice. And there's a spiral. You're gradually introduced to new things each time. Actually, our curriculum has 3 spirals, 3 phases. The first phase is the foundations of medicine. Here, it's 2 years of basic material, anatomies, physiologies, biochemistries. You learn about the body and health. The third year is the second phase, the foundation of clinical practice. Now you're introduced to the body and disease. What can go wrong? These are the pathophysiologies. This stage is very important in your transition to the last phase of your curriculum, the third spiral, where you are now into the hospitals, where you're now in your clinical training. In order to help it make sense, let me give you an example. In your very, very first year, one of the things you'll be doing in anatomy is you're going to learn about the anatomy of the rib cage, or what we call the thoracic wall, the ribs and so forth. Okay, it's not too complicated. Within a semester, however, you're going to use what you learned from the anatomy of the thoracic wall or the rib cage to understand the structures underneath it, to use them as landmarks so you can define where the heart is, where the lungs are, where the valves of the heart are, so that you can auscultate, so you can listen to the function of the heart. And actually, the following year, you're going to be using that to relate it to the physical exam. All of this in your preclinical training, so that when you're in your clinical training, you can relate all of that to your doctoring, to your clinical practice of the cardiovascular and respiratory system. So this is the type of spiral that we do in all of your subjects. Now, the question is, you know what the program is like, why we do what we do. What is your life going to be like as a student at European University, Cyprus? What is your program going to be like? What are you going to do? Okay, yes, you're going to attend lectures. These are introductory lectures. Unlike many schools, you're not going to be devoted to lectures, and endless memorization. Your lectures are going to give you basic concepts. They're going to highlight the most important information, and they're going to integrate that basic information with clinical practice. Very important part of your learning program is the team-based learning. You'll be in teams, peer groups. Remember the teams that we spoke about in the beginning as an important part of the new doctor? Everything you do in terms of your practical training is going to be in a team. This not only improves your learning, it improves very important skills of cooperation, communication, and professionalism. Yes, you'll be doing wet labs. You'll be doing laboratory work for courses like molecular biology, for biochemistry, for cell biology. This is important. Why is it important? It's experience-based learning. You get your hands in there. You learn critical thinking. You learn how to evaluate the data. You'll also have structural labs for histology, for anatomy, so you can understand the structures, the relationships of things. Remember how we use the structures of the thoracic cage or the rib cage to look at the structures underneath as landmarks. Here you can see a group of students using the X-ray to measure the scoliosis curve of patients. These are very practical exercises that you'll be doing in your structure labs. At European University Cyprus, we use new technologies. We use virtual reality. We use augmented reality, as you can see here for anatomy. We use computer-assisted learning for almost all courses. From day one, you'll be exposed to new technologies. Digital health is a big thing in medical practice. Digital technology is very important in modern medical education. Having a feel what our program is like and some of the things you'll be doing, what are the cornerstones of our program at European University Cyprus? One of our big cornerstones is active learning. You're not going to be sitting passively listening to material in the lecture. You're going to be actively involved in practical sessions. This is team-based learning where you'll be exposed and learning clinical skills. And you'll be hearing a little bit more about this as we go forward. You'll be exposed to critical thinking. Remember how we said knowledge is increasing and it's increasing and changing so much? This is why critical thinking is so important. Yes, you'll be exposed to problem-based learning. You'll be given clinical cases and problems to solve and present. Very important part of our program. You'll be listening to clinical association lectures. You'll be reviewing the literature in basic courses like biochemistry and cell biology and presenting a poster, analyzing the information that you've discovered. Very important cornerstone is a very early introduction to medical practice. Here you see our second-year students at the beginning of the second year who are receiving their stethoscopes for physiology 2. This is a very early introduction to clinical skills. And on the right, you can see where they're going into the simulated hospital ward to learn how to use these stethoscopes. An important cornerstone for European University Cyprus is we embrace advanced medical education, clinical skills, virtual reality, and simulation. Simulation and skills training is our most important cornerstone. It's our most important teaching tool. Those of you that heard Dr. Dourakis last week got a very good feeling about what simulation is about. We have a very well-developed simulation and skills training complex. It includes various things. A high-fidelity simulation complex series of rooms. We have 3 of these, and we're making more. We have simulated outpatient consulting rooms. We have procedural skills and training rooms where you learn specific procedures and tasks. And we have a standardized hospital training suite. This complex is so well developed that it's received rewards. It's been awarded for best educational installation, and it's been awarded for best medical solutions. Let's look at these a little bit more so you understand how you'll be using them. First of all, let's start out with what is simulation? Simulation is a controlled experience. It's a guided experience that resembles something that's real. It gives you a chance to practice what you will be exposed to in real life, but under controlled circumstances, so that if you make a mistake, it's not going to injure anyone or harm anyone. We use different types of simulation. We use human patient simulators. We use task trainers or skill trainers. We use standardized patients and virtual reality. Let's take a look at each of these. Human patient simulators are very complex. It's like a real human. And if you see here, they're in rooms that resemble a hospital room. These rooms have all of the equipment that you would find in a normal hospital room. It has ECG, it has monitors for all of the things. These mannequins are equipped with technologies that are able to respond like a living person. We program them for various things. So the students, as they're trying to learn to diagnose or they're trying to treat, they'll learn from their mistakes. They'll follow what's happening as the mannequin responds. And we are watching and guiding you through. Standardized patient. Standardized patient is another type of simulation. Here, someone is trained to act like a patient and look like a patient. They have makeup and so forth. And the students are exposed to this person to learn how to diagnose, to do the physical exam, and to treat. Task trainers. This is for learning skills. It provides training on very specific skills with a checklist that you can repeat over and over and over. We have numerous task trainers. Here you can see ultrasound, intubation, how to put in a catheter, how to do an EKG, even how to do a lumbar puncture, how to put in a urine catheter. These are all skills that you will be doing and mastering before you make it to the hospital. Actually, our procedural and skills training room and test trainers allow you to learn very basic and very advanced clinical skills, and you master them well before you're in the clinical environment. Our high fidelity simulation complex teach you how to diagnose and treat, to learn from your errors so that you're prepared when you make it to the hospital in your 4th year. Of course, that was the preclinical training. When it comes time for your clinical training, European University Cyprus has a big, broad network, training network in Cyprus with over 1,000 beds for you to be exposed to cardiology, to respiratory medicine, to neurosurgery, to neurology. It's all there. European University Cyprus also has exclusive sites, both in Cyprus, in Greece, and in other places as well. Does it work? Is our training working? I'd like to show you some evidence that it does. You all met Dr. Durakis last week. Dr. Durakis takes students who do well in his surgical course to another course in Strasbourg, France, which is actually quite advanced. It's for senior students and young doctors on surgical technologies and innovations. Our junior students have done extremely well when they've gone there and come away with several awards. Another example of how this training is successful is the medical students' superior performance in the essential skills for medical training that is done at Alpen. This is a joint effort from the UK, King's College and Imperial, and Greece. And we've sent our students there to become trained as well. Actually, some of our students have done so well that they now serve as junior instructors. Just to wrap a few things up, you should recognize that European University Cyprus is well qualified. It is on the USA recognition platform in terms of the Educational Commission for Foreign Medical Graduates, the ECFMG. We're on the European recognition platform, the IMI, which is equivalency with the medical schools throughout Europe. And of course, we're fully accredited with one of the most competitive processes, the World Federation of Medical Education process, which is internationally recognized. So the medical education program at EUC, at European University Cyprus, is well qualified and allows you to move out forward in your future well qualified. But as you saw in my introduction, learning medicine is not the only part of medicine. Part of medicine and becoming a good medical doctor and your journey in becoming a medical doctor is being exposed to research and science. Part of this is, yes, you're going to be exposed to making a medical thesis, to writing a medical thesis, but you're also going to be exposed to scientific congresses. One very important scientific congress, which is hosted by European University Cyprus every year under the guidance and auspices of the chair of the Department of Medicine, Professor Patrikios, is the Biomedical Multi-Thematic Congress. This is a large congress that happens every year and usually has Nobel laureates who are invited. These Nobel laureates, mind you, have become honorary professors of European University Cyprus, as well have opened their labs to some of our students, and you'll see what I mean in just a second. Last year, we had the pleasure of having Sir Magni Yacoub, very famous cardiothoracic surgeon. Now, why am I telling you about these meetings? Because you can say, well, I want to study medicine. This doesn't really relate to me. Our students are actively participating in these meetings. They become part of these meetings. This is actually their time, as you can see here, that they meet these giants in clinical practice and research, the big names in medicine of the date. This is a chance that you rub elbows and rub shoulders with the top people in the world in medical science. Actually, becoming experienced in rubbing elbows with big names is not just through these congresses. Our students every summer have the opportunity to go on a summer externship. This is a practical experience, 1 month, 2 months, that can be clinical or research on various topics in various countries. Let me give you an example of some of the places that our students go to. For example, in the US, we have 7 centers that we can go. Here I've listed a few. Shriners Hospital, for those who are interested in surgery, who are interested in pediatric surgery and orthopedic surgery more specifically. Perelman Medical School at the University of Pennsylvania. Johns Hopkins. These are prime institutes, well-known institutes around the world. In the UK, we have 14 sites. Here are a few. These include Oxford University for those who are interested in transplantation surgery or for those who are interested in diabetes, but it also includes Imperial College London and many more. I'm putting in Israel. And the reason I'm showing you Israel is because in Israel, we have 3 sites. All 3 are in the labs of Nobel laureates like Yonath Ada at the Weizmann Institute of Science, or Hanover. Can you imagine to put on your CV, on your biographical sketch, that you spent a summer studying and working in the lab of a Nobel laureate? Our students have this opportunity. Last year alone, we had 60 different placements in different areas in 10 different countries. Each placement has several slots for students. A very wide range for our students to go on a summer externship. But that's not the only exposure they have to science. Our students have presented at international congresses throughout Europe. They've presented posters, they've presented at round tables, they've presented even short presentations. Actually, our students organize their own Congress, the Cyprus Annual Medical Students Meeting, or the CAMES meeting, which has round tables and abstract presentations and loads of workshops. EUC students love workshops. One of their most famous workshops are the suturing workshops for skills. But at the last meeting, they also had a workshop on how to deliver a baby with Victoria, one of our best simulators. And so students learn how to do a normal delivery. But it's not just the science. European University Cyprus medical students also connect with society. They do charities, as you see here. They went to a hospital, gave gifts to small children who were stuck in the hospital at Christmas. They do small activities for young children to teach them about biology or researchers' night. Actually, they've even won awards for some of these activities. And then they do real science activities. They go out to the community to teach people and help people and inform people about health problems. One very popular activity was Watch Your Heart, Keep It Young with Dr. Carpetas, one of our faculty members who were traveling with students around towns in Cyprus, informing them about how to stay healthy and keep their heart healthy. Now, during the COVID crisis, we had other issues. We had students that were volunteering to help the doctor shortage in hospitals and in their own way help the COVID crisis. So European University Cyprus medical students connect with society in many, many ways. So you have a picture a little bit about what you will do, what your life would be like as a medical student across the 6 years. And of course, at the end of the 6 years, you get to the big event, the commencement, the graduation event. Here, a lot of things happen. One thing you see is the hooding by the faculty. Okay, I understand that many of you won't know what hooding is. Look here at these two pictures and you see that there's a professor standing behind a student. And you notice that they're wearing green. Green is the color of medicine. Each faculty member passes a large hood, it's like a ribbon, if you will, across the head of each student. This tells the student that you've completed your studies of medicine. You are now a medical doctor, and I consider you equal to me. Very important step. Remember, in the beginning, in the student orientation, in the white coat ceremony, the faculty gave you your white coat saying, you're welcome to our family, and now I'm going to train you. And at the end of the journey, your faculty member will give you your hood and says, now you've been trained. I recognize you as a medical doctor. With that, you then sign the book of graduates. What is this? You sign a large book with all of our graduates' names. And here, for the very first time ever in your life, you will sign your name with the initials MD after your name, medical doctor. You will do that in front of your family, in front of your friends, and of course, in front of your faculty. At the end of the commencement, the same way we had at the convocation, you will say an oath. This time, yes, this time it is the Hippocratic Oath. This is the oath that binds you to the ethics of being a good medical doctor. It's a long journey, a very long journey, but a very good journey. And I hope you got some pictures of what happened. What happens with our graduates after that journey? Oh, they start their residencies. Right now, they have residencies going on in Greece, Cyprus, UK, Austria, in various topics, orthopedics, dermatology, primary care, pediatrics. Yes, you're wondering, what happened to Lucas? Okay, I didn't forget. Lucas had some problems in the beginning. He struggled a little bit. We have a very good advisory system, and he worked with the advisors. He teamed up with peer teaching. He did well. He got through. Yes, he did go on an externship. Yes, he did go on the training course, the essential skills at Alpan. And actually, yes, he did become an instructor, a junior instructor there. Towards the end of his journey, he had a difficult time. One of his very beloved family members became very ill and actually passed away. This was a very difficult step, very difficult time for Lucas, and I think he almost wanted to give up. But yes, Lucas did graduate. And not only did he graduate, he wrote a medical thesis on the very disease that made him lose his very close family member, his mother. Not only did he complete. Not only did he graduate, he went on within 3 months to present his medical thesis, the very first medical thesis to be presented at the Congress of the European Society of Gynecology Endoscopy, and pursue a residency program in gynecology. The big journey, it's a good journey. Now, my question to you is, what will your journey be? What is your plan? How do you see yourself being a student at European University Cyprus? Having said all of that, and in relation to the other things that we've seen, I'm going to open up my chat box and see what questions you may have. If there's anything that I can answer. I would like to say that all of the webinars are made available on the website of the European University Cyprus. If you have any questions about the admissions process or anything else, these are all available and easy to answer by our wonderful staff who's quite prepared. There is a question about, is there any simulation for the exam? Yes. You will be examined with simulation, and actually we'll be doing standardized patients exams, you'll be doing simulation exams. This is part of your training. So yes, you'll be assessed on your ability to perform in simulation. These are called OSCEs, Objective Structured Clinical Exams. And I'm looking through your list of questions here to see if there's anything else. And I'm seeing that people are asking mostly about entrance criteria, which you can receive from our admissions office. And I'm reminding you that everything that I said today is related only to European University Cyprus. And I'm looking through questions. And I'm not seeing anything that is related to what we were talking about. You are, is the school accredited in the Middle East? It is a world accreditation. It's an international accreditation. This is why it's called the World Federation of Medical Education. Each country has its own requests, but this is one of the most widely used accrediting systems and actually the most demanding for a university to go through. And I see nothing else here that I can answer. So having said that, I'd like to thank you so much for joining me. I wish you all well. And if you have any questions, please visit the European University Cyprus website. Thank you so much and good night.